This week we're talking about health insurance. So first, let's talk about why it's important. What health insurance does, and what any insurance does, is it protects you in the event of a loss. And so it mitigates your exposure to certain risks. So with health insurance, you're mitigating your exposure to health risks, whether they are due to an accident or an illness. But health insurance is important because if you have a catastrophic accident or illness, that could wipe you out financially. And so we know that in this country, quite a few people have gone into bankruptcy because of medical expenses that they couldn't pay. Another issue in this country is the rising cost of health insurance, and so there have been some measures put in place. We won't have a political discussion about that, but that is something that's on pretty much everybody's radar, but that doesn't lessen the fact that health insurance is important. So let's talk about different health insurance plans. There are private health insurance plans that are available to individuals or to families, and these are provided as group health insurance. So this would be the insurance that you get through your employer. Now, a traditional, what's called indemnity plan, is one that's also called a fee-for-service plan. So typically you have an unlimited choice of doctors and hospitals, and then you you pay a deductible plus a percentage of the cost, so maybe 20 or 30% of the cost of the service after you've paid your deductible. And then you get reimbursed based on what your insurance company has decided are what we call UCR charges, usual, customary, and reasonable. Then there are managed care plans. So first was traditional indemnity, then next is a managed care plan. So a managed care plan is when you don't have freedom to pick your doctor, so you are limited to a certain pool of doctors and hospitals that can provide services for you. And the benefit of that is that it holds down costs because these doctors and hospitals have agreed to a certain fee schedule. So there are different types of these managed care plans. One that most people have heard of is an HMO, or a health maintenance organization. And so there are group HMOs that are related to those group policies through employers. Then there's something, there are individual practice associations that contract with physicians who operate out of their own offices. And so that's under the umbrella of an HMO. So really these are different types of HMOs. So there's a PPO, which is a preferred provider organization, which gives you a wider network of physicians to choose from. And with a PPO, you can even go out of network, but you just have to realize that you're going to have to pay more for that. Then there's something called an EPO, all kinds of O's. An EPO, which is an exclusive provider organization, you either use these specific doctors or you have to pay the entire cost of the service. And then a POS, a point of service plan, which reimburses the members within the plan, kind of like an indemnity, that traditional indemnity plan that we talked about before, but this kicks in when you go out of network. Now, Blue Cross Blue Shield is a very popular provider across the country, and especially in Alabama. And so there are different Blue Cross Blue Shield plans. There are ones with prepaid hospital and medical expense plans, and so that's actually a prepaid plan, which isn't actually insurance. And so Blue Cross acts as an intermediary between the groups that want health care and then the physicians who are providing their services. So they're kind of a broker for the doctors. So here's just kind of a summary of these different types of plans that we've talked about: the indemnity, the HMO, and the PPO. So do you get a choice of providers? Yes, on the indemnity, that's that traditional plan. On the PPO, you get some choice, but typically on an HMO, you don't get a choice. And so that's a probably the biggest difference between these three plans. Premiums are comparable, but it's going to vary across the different types of plans. And then the out-of-pocket is usually a percentage, like we talked about on the traditional indemnity, and then you'll have an actual dollar amount copay on the managed care plans, the HMO and the PPO. That indemnity plan has a deductible while the others do not. And so the HMO and PPO typically are popular for people who are trying to keep their healthcare costs down and are flexible about their providers. The indemnity plan typically appeals to people who are willing to pay a little bit more in order to have much more choice over their providers.